I was so glad she was like a female surgeon because that made me had a little more peace of mind because, I mean, who was going to understand you better than another woman? Hi, my name is Sandra Guillen, and my whole journey started when I was pregnant with my second child back in 2015. When I actually was living in Houston. So when I told my doctor back then my family history, which is my mom, it's a breast cancer survivor. I have two of her sisters that unfortunately already passed away because of breast cancer. So my doctor was really recommending me to get the BRCA test done. So I decided to do it. And sure enough, when the results came back, I am a BRCA2 positive, which means I'm really prompt to get breast cancer, ovarian, and pancreatic cancer. She sent me with an oncologist, and I went and visited with her. She showed me my options. Then we had to move over here to El Paso. So then I started going with my OBGYN here, Dr. No. He recommended me to visit with Dr. Lee. So I asked for all the paperwork to be transferred from Houston to over here. And then that's how I got to meet Dr. Lee. For me, which has been a blessing because she explained all of my choices that I have since I'm in a BRCA2 positive. So she gave me my two options, which she says, of course, I have to remove my breast. And to reconstruct, she gave me two options. It could either be with implants or the DIEP flap reconstruction. She explained to me that with the DIEP flap, it's going to be more permanent. So I decided to go with that choice. My surgery was done in the summer, back in June. So I had the DIEP flap reconstruction, which is using the skin and the fat of my abdomen to reconstruct my breast. And then there's a second part of the surgery coming up in October. And my whole experience with Dr. Lee has been amazing. She has always been there answering my questions. This has not been an easy decision, but again, with my whole family history, I am 100% sure I didn't want to get breast cancer, so that's why I went ahead and proceed with the surgery. And I believe it has been one of the best decisions that I have made, and I'm really happy with the results so far. Dr. Lee and her whole staff have always been helpful. Every time I have a question, they're there for me, and they've been able to answer all of my questions.